All right. Well, good afternoon, and thank you for joining us today. What a great way to kick off our conversation with that luncheon, and thank you to all of the staff from all the different organizations that worked so hard to make that happen. That was just a wonderful way to celebrate the work that's been done. So I'm Pam Wheelock, Chair of the DMCC Board, which you have probably all know or have concluded after our lunch. So we have a tradition for this once-a-year gathering of the public bodies most responsible for the initiative to come together, really not to make decisions or to conduct any business, but to either learn together, get to know each other better, or better understand perspectives and priorities for the different entities that have come together to do this work. So that's why around this table we see the mayor and members of the city council, the county board, the DMC EDA, and the DMC Corporation, and their staff leaders as well. Last year when we met, it was within months of Mayo Clinic's historic announcement of Bold Forward Unbound in Rochester. And now as we navigate the downtown, we can already see the transformation that has occurred, continues to occur, and it's a indicator of how much more is coming as well. So a lot of work has been done. It's going on now, and we've got more to come. And it's an impressive sign that Mayo Clinic and the city and county are living up to the promise of growth and investment that was made to the legislature and to the governor in 2013. As part of the commitment to leverage state resources, to supplement local resources, to make all of the important investments in infrastructure that are necessary for that multi-billion-dollar investment. So we now have the opportunity to dive into the details of that growth and investment and how it's impacted jobs, growth in the tax space, and increases in downtown housing availability and the such. So hopefully we'll all have a better understanding when we leave about what has been accomplished, how far we've advanced on some of our key strategic goals. And I know the city is deeply involved and continues to update plans. The DMC board is going to be updating our planning process later this year. So this is really good to have a shared understanding of the progress to date and help us think a little bit about the strategies and priorities going forward. Now, I introduced myself, but I know that many of us are new and sitting at this table at the first time, and if we only get together once a year, it's good to refresh who we are and what our names are and reintroduce ourselves. So we're just going to go around the table, and I'll invite you to share your name and what entity you're affiliated with, and we'll take it from there. So I'm going to go to my left and invite Council President Schubring to go next.
Thank you, Madam Chair. Randy Schubring, I wear two hats here. I am the Rochester City Council President and on the DMCC Board, and I was acutely aware during the not celebration today that all the football game references that I am a part of making sure the second half of the game goes well. So, but congratulations to those who participated in the first half, and handing it off to me, I will do my best.
I'm Mark Tyne, Olmsted County Commissioner.
Clark Otley, Mayo Doc, and the President of the DMC EDA Board.
Good afternoon, everyone. My name is Travis Gransee, and I'm the Olmsted County Administrator.
Bob Hopkins, Olmsted County Commissioner.
And I'm Paul Williams, DMCC board member, about 6 years now in affordable housing neighborhood revitalization person.
And I'm Tom Fisher. I'm a professor at the University of Minnesota Twin Cities campus, and I'm on the EDA board.
And I'm Laurel Podolsky-Smith, Olmsted County Commissioner.
Patrick Keene, the City of Rochester, Ward 1 representative.
Good afternoon. I'm Michelle Rossman. I'm serving as an Olmsted County Commissioner.
Good afternoon, Nick Miller, Rochester City Council.
Hello, Brian Mueller, Olmsted County Commissioner.
Good afternoon, Dan Doring, Rochester City Council, representing Ward 6.
Hi, I'm Jim Campbell. I'm a DMC board member and I think I'm the last original DMC board member remaining, which means it must be halftime. I must be just about finished.
I'm Jim's lutefisk eating partner at East St. Olaf, amongst other things, but Dave Sindrum, an Olmsted County Commissioner.
Norman Wall, honored to be serving on the Rochester City Council.
Doug Baker, I'm on the DMC board. I'm also on the Mayo Board of Advisors.
Greg Wright, Olmsted County Commissioner.
Cindy Steinhauser, Deputy City Administrator for City of Rochester.
I'm Patrick Seeb with Destination Medical Center Economic Development Agency.
Kim Norton, Mayor, City of Rochester, and also Vice Chair, I guess, of the DMCC Board.
You absolutely are, yes, as we voted again today, so. All right, well, thank you. I know that we got a late start, and so I want to move pretty quickly into our presentation here. I'll encourage everybody at the table as we go through the presentation, feel free to raise your hand, jump in, negotiate with your seatmates about access to a microphone, and ask your questions as we go through the material. Don't be shy. I should also note that the importance of community engagement will be an ongoing part of not only DMC's planning process, but others. So for any members of the public, and some people might be participating online or virtually and watching this, there is, for those that are here, there's a QR code at your seat that probably looks like it's on a piece of paper like this. And you may use that to offer your input, and there are also paper input forms near the entrance of the room. And I'm assuming if we don't have that available online, we'll figure out how to add that in some fashion. So we're just going to move forward and jump into this, and I'm going to turn it over to Patrick to get us moving.
Thank you. No further introductions other than Catherine Malmberg from the DMC team, who will introduce the team that has been working with us as we've been doing this data collection and as we're beginning the kickoff for our 5-year update. Catherine?
Wonderful. Thank you so much, and thank you all for being here today and being a part of this conversation. It's a really exciting moment as we are ready to share some of the preliminary key findings from the look back, what we call the look back portion of the update. So before we really launch the work to look ahead and start to reproject what's coming in the next 5 to 10 years of the DMC initiative, first we thought it was quite important to really gather the data of the first 10 years and compare it against the original goals. So to that end, we have collaborated with some various consultant teams who are represented here today. So it's my pleasure to introduce Beckie DeJoseph here from Econsult, and she'll tell you a little bit more about herself when she begins the presentation. She's really going to be leading that look back. And then also in the room today, we have a team led by SmithGroup and Michael Johnson here with me today as well. And he has colleagues, if you could take a second to call them out as well. And they'll be leading the look ahead work, so they'll become familiar faces over the next several months.
Awesome. Thanks, Catherine, and good to be here with you all today. So with me today, my colleague Mashri, my colleague Bridget, and then my colleague Jenna here with SEH, also locally. And then our colleagues that are not here with us today, James Lima, Planning and Design, based out of New York City on the economic development side. So really look forward to kicking off the process, and we'll get integrated in the conversation today. So
wonderful. So, and before we begin, and I'll be passing it to Beckie here shortly, I just wanted to, we have prepared some of these materials for you in advance. Are there any sort of key themes or areas where you have questions or definitely want to hear more about before we start the presentation? And we'll be sure to address those through the course of the presentation. But I want to give people the opportunity to provide some preliminary input if there's something you want to make sure that we've really touched upon or dig a little deeper on.
I think that will be prompted as you go through your presentation. So let's just jump in, and I know this is a group that won't be shy about asking questions as we get there.
Wonderful. And there will be, Beckie will show us there are breaks throughout the presentation around each goal for conversation. So with that, I pass it to you.
Thanks so much, and thank you so much for having me here today. I did not think that I would get to follow a governor, especially the best governor. So I'm a little starstruck, but my name is Beckie DeJoseph. I'm with a firm out of Philadelphia called Econsult Solutions. Prior to working at Econsult Solutions for about the past 8 years, I worked at the U.S. Bureau of Labor Statistics, working on the quarterly census of employment and wages. I am also a full-time professor of economics and statistics at the Community College of Philadelphia. So I'm very excited to be here today. Our firm, ESI, as you can see, I did not do this alone. We had a full project team as well as a subcontractor, Kevin Hively. Econsult Solutions, we like to say that we are at the intersection between planning, policy, and economic development. So very excited to have had the chance to work with the DMC EDA leadership to really look at this 10-year retrospective and really get grounded in what has happened so far, what challenges remain, and and I'll say we, because I am now integrated into this, where do we go from here? So I'm gonna get started. First, a little bit about our time frame. So just to give you all a background, we started in January and we came on site in March to share some very preliminary initial findings. But within that March visit, we really got to speak with stakeholders, walk the DMC, and really see the transformation and what Rochester is all about. So that was extremely helpful to get us grounded in our data. Today we are going to share preliminary findings, and we will have an executive summary for you all finalized next month. As you'll see, this is a lot of data, and that data came from many different places. Data collected from the DMC EDA, data from my alma mater, the U.S. Bureau of Labor Statistics and the U.S. Census Bureau, as well as some proprietary real-time data sources, such as Lightcast, InPlan, and CoStar. We are going to go through the findings of this analysis, and the way that the report is set up was really based on how the initial 2015 plan was set up. So that plan was extremely intentional. It was extremely aspirational. It was prescriptive at times, saying that these are down to the square footage what we hope to see. But the vision that we hope to translate to where are we now really came forward in that document. So what we're going to do today is go through the 5 major goals of the original plan, see what was the goal of that 20-year, where are we now, and what can we learn from that. So we're not going to go from left to right. We're going to start with jobs. We're going to go into the public and private investments with a very key emphasis on those private investments. We're then going to go into taxes. Hopefully spend a lot of time on experience, because that is really another one of the core objectives of the plan, was how are all of this built environment and this investment going to translate into a different shared experience across different user groups. And then finally talk about the plans and talk about the collaboration and what has happened in the past 10 years to really make it the celebration that I know we are not saying it is, that it is today. Throughout each one of these 5 sections, at the end, we are going to have a slide that looks like this. The first 2 are going to be the key takeaways of which, where has the DMC exceeded expectations, where are we on target, and then what are the opportunities going forward. And when we see this blue dot here, this blue symbol, that is when I will stop talking. And again, I said I'm an instructor, so I can go on for hours if need be. But that is when I will stop talking and really hope to hear from you to, again, question anything that you might be seeing or offer some insights into where does the DMC go from here. So with that, I will get started on jobs. So one of the core objectives of the plan was to increase jobs, and that goal was a lofty goal, 35,000 to 45,000 jobs over a 20-year period. This is at a time when there were about 36,000 jobs, so that is a pretty substantial aspirational goal. I'm happy to report that we are at 17,500 jobs, about 50% of the stated goal, 10 years, so right on target. And we can see this here, that these 17,500 jobs, on the slide over here, we can see that there is a dark green and there is a light green. So we see 17,500 jobs from 2015 to 2022, an increase of 47%. And at the bottom, you can see that healthcare and social assistance is that large green, right? We are anchored in Mayo. We are here to bolster the economic activity that can grow out of a fantastic #1 hospital system in the world. And 16,000 of those 17,500 jobs over the past 10 years have been in healthcare and social assistance.
Beckie, I'm wondering if you could just clarify, are those full-time equivalents, and how do you think about seasonal or short-term employment, including maybe construction workers who will be working on the project?
Sure, so to clarify, these are the jobs that are within the 1 square mile. So this is just, so construction I will talk about in a couple slides, but for the most part, the way that the data will show up is that construction growth is going to be within Olmsted County or regional, because unless you are at a job for over a year, you are going to be reported at wherever your base is. So construction jobs, while they do show up as growth in here, is not as large as when we get to the Olmsted County. In terms of what this stat is specifically showing, this is primary jobs. So this is counting the job, it's counting a person. There are some data sources out there that if you work 2 jobs, you will be counted twice. This is only looking at primary jobs because that is as close that we can get to actual humans in a job. If it is only a part-time job, that will be included as long as that is your primary job. One other thing to point out with this data source is that it is 2025 and I am only showing data until 2022. And that is because the data source that we used for this is the U.S. Census Bureau On the Map. And On the Map is the gold standard for geospatial employment data. We're able to see the actual geocoded establishment level data, where are individuals working, and then also where are they living. So that is why it's only until 2022, because the data for 2023 will not be available until December, but it is really the best if you're looking for something as small as the district and really understanding what's going on there. But back to those 17,500 jobs. 16,000 of them are within the healthcare and social assistance services. So if a goal, one of the primary goals of the original plan was employment diversification, only 1,500 is that substantial. So maybe if you think about 1,500 jobs, it might not seem all that substantial until you actually look at the trend over time. So what we see here is non-healthcare job growth. And from 2003 to 2014, it was stagnant. There was 6,800 jobs in 2003, up to, well, down to 6,500 in 2015. And then we see that there is from a flat slope to a not flat slope, going into a 23% growth up to 2022 employment of 8,000. So while those little green bars might be trumped by those large lighter green bars, we can see that there is a substantial difference and a difference in slope over time. So that additional 1,500 in employment, we see that the majority of that was in professional office and administrative services, as well as education and some construction.
Can I just comment?
Yes, go ahead.
I find myself being the historian, but at least in the Minnesota Senate, and Mayor Norton and I are looking around the table. We're maybe one of the few people in this room that were kind of here at the beginning, but on the Senate side, Mayo came to us and said, we will invest $3.5 billion in our own practice. We will cause to have affected another $1.5 billion of outside money to be procured through the Mayo EDU. And then they said, and I don't know where 35 and 40, but it was consistent, at least in the Senate, that it would be 25,000 jobs directly with Mayo Clinic or indirectly because DMC would happen, if Mayo, DMC did happen. That was the message of the Senate, at least for purposes of history. So I don't know where, it doesn't matter. I hope we get 45,000. The legislative promise was at 25,000. And we're well on the way. That's what
Okay, so to put this in perspective, looking at a group of peer cities. Now, these peer cities were selected not because Rochester had higher growth. The peer cities were selected because The 4 that you see here also have a high indication of anchor reliance. The Philadelphia Federal Reserve has an index that's called the Anchor Reliance Index, and it takes a look at how much of the employment is based on either one large or a few large universities or hospital systems. And the ones that you see here all have a high reliance on an anchor institution, which would make them a good peer city. They are also, with the exception of Madison, very similar in size and also geographically similar. So this data here is showing the Rochester MSA growth. It's smaller than that of the DMC, but in comparison over the past decade, compared to these 4 other peer cities, the Rochester MSA has outpaced that growth. Now, what is also interesting is that if you take a look back further, back to that period of time where we saw that stagnant non-healthcare employment growth, Rochester was actually 4th. Madison was the only one that had lower growth. So in sum together, the growth over the 20-year period is would be 3rd for Rochester, but really all of that was made up in the last decade. Construction. I've been here for 2 days and I've heard about construction a lot and the pain that comes from construction. But from an economic development standpoint, that means that you need construction, capital investment, before you have ongoing investment, right? So before you do have a little bit of that pain, but the construction that we are seeing in the DMC, because the DMC is a 20-year plan, what that does is that gives business owners the incentive, construction owners, the incentive to grow and to feel like they will be able to sustain their business for an extended period of time. And what we see here is there has been an increase of 900 jobs in Olmsted County over this time period. But what we've also seen from additional types of initiatives that were brought from the DMC EDA is that knowing that there would be this huge boom in construction over a 20-year period, there was intention to not have this be to just the established firms. So with the intention of having it be a more diversive, a more inclusive, and a more equitable growth, we can see down on the bottom the minority and women employment has, again, small numbers, but high small numeric change, but high percent change. And we see that minority and women employment within the construction industry has increased over this period. In terms of household income growth, we see that each of the 3 locations here, Rochester, Minnesota, and the nation, are all following the same trajectory. We do see that Rochester did have a bit higher of a gap above the state of Minnesota, and that is starting to narrow. So that is something that if we think about in the future, wages, as we have the highest levels of inflation in a very long time, that is something to look out for. The line graph has not intersected, so it's still above the state average, but it is closing into the state average.
Madam Chair?
Yep. Member Williams.
Just curious whether we have any kind of wage level breakdowns for the job growth. I saw it in construction, but do we have that more broadly? Obviously, healthcare would be the big category.
So there is data. Unfortunately, the data that we're showing specifically for the DMC, because it is so granular, the wage brackets that they are able to produce are very wide, and they don't really tell you that much information, and that has to get that comes down to suppression issues. At the broader level, yes, there is data available that we can provide that looks at the wages at the county or city level.
Sure. And so just to follow up on that, I think if the job growth is more diverse about the income level that's associated with the new jobs, we shouldn't misinterpret that this is necessarily a bad thing. It may just mean that the wage base is much more diverse than historically it's been.
Yes.
We have more jobs, but at different income levels, and so that will reflect maybe a little bit more closer to the state of Minnesota than our historic.
I would think that would be correct. In terms of some unique tools developed, talking about the construction jobs and putting out an RFP for Discovery Walk that breaks it up so that it's more manageable for smaller businesses. This was actually something that was identified by Bloomberg Global Mayors Challenge, and as you all know, Rochester was one of 15 cities in the world out of 13 different nations to receive this recognition. So again, thinking back that this was in 2015, before really we had more of a diversity eye to things, it really was a novel approach. And again, there's other unique tools developed that aren't necessarily 100% quantifiable, but the partnerships with the local colleges, workforce development, and DMC business development program is all of those actual people that are coming together and creating the things that can be quantified. So we are at the last part of Mine for Jobs. Above expected, comparative job growth compared to Minnesota and to peer cities is much higher than would have been expected given the previous trajectory. If we would have forecasted that out, we would not have expected what was seen. Overall DMC job growth, about halfway of the 35 to 45,000. And then opportunities. We see that there is nascent stages of employer and employment diversification, but what is the next step? How does that grow? How does it go from 1,500 jobs to 10,000 jobs? So I will pause there, Catherine.
Yes. So opening the floor now for discussion around the jobs. Questions, comments, feedback, thoughts, especially I think we'd be interested to hear thoughts on those opportunities and where all of you from your unique perspectives see those opportunities.
I guess I want to comment just on the way we use the data. It is interesting to do the DMC district, but as a council member, I'm much more interested in the metropolitan and the economic impact, and those numbers are probably more interesting. I'm not sure if that's across the table, but that idea of like whether construction jobs are stationed here. I know the data. I imagine there's a lot of complexity into getting them down to these simple views, but that would be my interest of the impact on the overall economy and not just the square mile or the district.
Any other comments? Yes.
Sorry, just want to build off of that. I was actually, especially today at the luncheon, hearing about the other spin-off businesses, related businesses throughout the county. Again, I know nothing about the depth of that, but it'd be interesting just to look at the numbers for the county as a whole, because Rochester is drawing, obviously, from the entire region. So it'd just be interesting to kind of look at that, at a future date.
Yes.
Thank you very much. I think overall, Rochester and Olmsted County benefits. So, you can't complain about that. It's really good. But I just want to remind people that Olmsted County deals with the people that probably has the less education, that are newly arrived to the country, that are trying to break into and lift themselves up into this great economy that we're talking about. And so for those people, I'm not sure that they are included in your numbers, but yet they also need a step up, and that falls on the county to do those kinds of things. Housing is one of the other ones that Mr. Williams knows about in order to do those things. So, the county, I think, does a great job in doing that, but it's also part of DMC's, I think, responsibility to help with that process, because those that we are dealing with their future employees that we want to bring up into the education system as well as into the economy, so that they will be great contributors in the future. So I'm not exactly sure if those people are included in your numbers or not.
Yeah, so the numbers, just to be very clear, the 17,500 jobs are those within the district. Yeah. We do have data on the city of Rochester, the MSA, the four-county MSA, just the Olmsted County, all the way out to Minnesota.
So what I'm hearing, oh, go ahead, Patrick.
I'm sorry, I was just going to say, I think to both of the points, Commissioner Wright and Councilmember Keene, Paul, I think there's more of the story to tell. Sometimes we hear at the city, they talk about building permits throughout the city and the growth of building permits. I think there is more of a story to tell about economic development doesn't honor prescribed boundaries. I mean, it's sort of artificial and established boundaries for purposes of where money is spent, but that's not necessarily how economic development really works or economic impact. And Commissioner Tyne, you talked about all that's going on in the outlying communities and United Therapeutics, et cetera. So I think that's the point is, how do we capture that? How do we reflect that going forward? And we do have somebody who's taking notes throughout this meeting. So while these folks are presenting, we're recording all of these comments and suggestions. So
I just want to piggyback on that because I think that where the job growth occurs, there's a relationship as well with transit and transportation needs, housing needs. So I do think we think of Rochester as kind of the economic engine for this whole southeastern Minnesota area, and we'll have to be clear about why we want what data and what decisions and it's intended to inform. But I do think we might want to think a little more broadly and intentionally than this DMZ zone. I think good points. Yep, jump in.
Just a couple of comments too on that. I think when we think about the taxes piece looking ahead, we often think about the impact of the DMC district, the impact to the county, to the state. And I think being able to tell that story to a member of this community who does not work in downtown, in the DMC district, does not live in downtown, where those benefits accrue to the general community member, and being able to quantify those, it goes beyond jobs. Separately, I very much appreciate the peer city comparison. As a former resident of Iowa City, I think we have a lot that we could see about what other Midwest academic centers are doing. And particularly in the look ahead, where we might bring in some of those comparisons of thinking about what generational investments might look like. We have a lot of benefit of being a Category 1 destination in healthcare, and yet I think we also have some peer cities that we can look to and bring these comparisons into all aspects and not just jobs.
I can't help it. I mean, the key though is driving more jobs, right? I mean, we're going to measure it and everything else, but we hope that the next measurement has it higher. So what has to happen? A lot of the things that are going on, I think, are exactly the right things. Mayo is an amazing economic engine for the state. It's in Rochester. It'd be very easy to just say, this exists everywhere. It does not. I think it's the single best economic engine for the state, like individual entity, better than 3M, better than Ecolab, dare I say, better than General Mills. It's just as a single entity. And the reason is because of the spin-off potential. And big corporations don't do that in the same way. And so the conversation we had here earlier about biolabs and creating infrastructure to make it easier and lower the bar for new companies to start and facilitating that is what's going to drive job diversification, probably the primary thing. So I just say a lot of the things that you're already doing are very smart, and you just want to make sure you keep on doing them, because the truth is we're very early in this story. We haven't seen one job out of the biolab idea yet, or any of these others. And I just want to just say maybe the obvious. The key is what drives them, not how to, I get into the measurement conversations all the time, but the most important thing is what do you need to do to drive better outcomes?
Madam Chair, if I could add to that. So I spent all morning talking about the impact AI is going to be having on job growth in the next 10 years. And so I think we have to factor in, technologies like that in terms of these numbers and what impact, what kind of jobs may disappear, and what are some new kinds of jobs that we may not even know what they are yet, but that might be coming in the next 10 years.
Absolutely. Yeah, that's one thing throughout my work, the AI and automation risk is throughout everything. I will say, though, that particularly healthcare, innovative healthcare, biotech, where I'm from in Philadelphia, we have a large cell and gene therapy innovation district, and that is what got us through the pandemic, because those people are in labs, they're working. Those jobs are from associate degree all the way to postdoc. So yeah, definitely something that no matter where you're at, that is going to be a conversation going forward. But luckily it is in something that I think will grow with the technology and not necessarily be 100% replaced by it.
But the irony is the first jobs that are being eliminated by AI are the coders. The guys who wrote AI. It really is, right? I mean,
absolutely.
It's sort of, oops.
Put ourselves out of business.
Let's move forward to the next section, and I'm just going to say, just feel free to jump in. Don't be recognized by the chair unless you start talking over each other, then I'll jump in.
I have a question. I absolutely do not mean to put Dr. Otley on the spot, but when the legislation was developed, there was, of course, the Mayo EDU, which was a separate economic development organization that was private, that wasn't subject to open meeting laws and data privacy issues, and it was felt necessary to be private because there's stuff that happens out here if you're going to recruit businesses. Are any of these numbers, or are we able to associate any of these numbers with the work of the Mayo EDU in terms of like what's happening at Discovery Square and things like that? Separate from what's happening at Mayo or anybody else? You get what I mean?
And are you
the educational side?
No.
These numbers are derived solely from publicly available sources,
Correct.
if that addresses the question. So while there maybe is potential to partner with Mayo to see if there are figures they would disclose, we are basing this upon publicly available data.
No, I think the question, as I understand the question, I think what the commissioner is asking for, is there a direct line between the work that DMC EDA is doing and these job numbers? I think that's what I'm understanding the question.
I mean, there are probably big Mayo numbers in here, but what about the EDU and their work, and can any of these numbers be attributed to their work? And I'm sure some can.
With
we
regard,
probably don't have a tally on it.
Commissioner, with regard to the activity in the Discovery Square sub-district, we have one full building, one half-full building, and we're beginning to consider the development of a third building based on the anticipated activity related to biolabs and other strategic projects at Mayo Clinic.
Madam Chair, would you contemplate there's a couple of hundred people in those buildings, or I have no idea.
I actually don't know the numbers of those.
That's all right.
We can certainly find those. Yep, we can add those.
Yeah, that's certainly an area as we develop the final report, if that's of interest, we can
So
dig
just
deeper.
noticing the energy in the room, I would suggest that we quickly get to the discussion slides. So that
Yep. Yeah. So now we're going to our second core area of the 2015 plan, and that was private investment, public and private investment. And as you all know, it was a novel approach that wasn't just let's put some government money in and hope private money comes after. It's actually the opposite. There needed to be $200 million in private investment before any money was unlocked. So what this does is this realigns those investments, and it makes sure that they are circular and it's not just completely a catalyst. To date, $1.8 billion in private investment, about 1/3 of that is non-Mayo dollars. The goal is by 2035 to have $5 billion. As we all know, it is anticipated that this will be fulfilled, the $5 billion by 2030. That obviously does not mean that, okay, let's just get rid of the DMC, met the goal, and it's over. That means that there is more conversation and a lot more planning that my friend Michael Johnson will help in the next 5 years to look forward of from here, where do we go? One point, this $1.8 billion invested, that is on building, that is on built infrastructure. That is in that 1.95 square mile down here, but what we can see here is that if we annualize that over the last 10 years, annually, the city of Rochester had an economic impact of about $235 million. So that's where we get that not everybody, you do not have a huge construction companies in the downtown, right? This is going to have indirect and induced effects throughout the region, and that's what we call economic impact. So this was additional economic impact beyond that initial investment that we see. Now, This is, I would say, the most interesting part of the research that we did. The 2015 plan actually was extremely prescriptive in what was to be achieved in 20 years, down to square footage, down to hotel keys, down to the number of residential units. So what you see here on the screen, and I'll go through these relatively quickly, and then I do want to touch upon research and education because I think those are particularly impressive, and then we'll talk about residential, retail, and hotel later in the experience. But what we're seeing here is the research is about 77% of the total goal. So there was about 1 million in square foot that was set out over 20 years, and the DMC is ahead of schedule, 785,000 square feet, as we know, in 1 Discovery, 2 Discovery, and the Kellen building. In term, plus the additional renovated space that is also included in here. When we look at office space, the goal was to have 310,000.
Can I ask a question just on the research square footage? Is that all occupied, or is there a percentage of which is occupied?
No, this is just the total built infrastructure, not including the occupancy. Yep. For office, there was a goal of 310.
I mean, to be clear, of that 785,000 square feet, Council President, but for about 50,000 square feet in 2 Discovery Square, that is all occupied space.
Thank you.
In terms of office, we are at about 60% of that goal. I do want to be clear here that the original plan did ask for net new office. Given that the plan did not anticipate a 2020 pandemic in which office space, if you started to build just office space, nobody's going to fund that. So this is renovated office space, so still above the goal. One thing that I do want to note here is that office space is one of those things that I think it would be an opportunity. The cost of office space is relatively high in Rochester. It is on par, a little bit above St. Paul and Minneapolis. In terms of residential units, the goal was 2,850 residential units at 55% of that goal, or about 1,600 units to date. Hotel keys, the goal in the plan was 1,380 hotel keys. We are at 690, so right around 50% or the midpoint. Education and retail were both at around 39%, so a little bit, those are the only two that have not been exactly at 50%. But again, the square footage doesn't tell the story, right? The square footage is just the accounting tool to look back on this plan. The plan had a vision, but that vision will change, right? I didn't plan 10 years ago of what I was going to be doing today. You have an idea, a goal, a vision for your life, for what you see, and those things are going to change. So some big points that I think from here and from what we've talked about earlier is the research. Having the #1 medical clinic in the world is a prime ground to have a lot of tech transfer that I know a lot of other cities, when we deal with innovation districts, would only dream about. And we have seen that from NIH funding that was non-Mayo. In 2013, there was only 18,000. In 2023, there was 6.9 million in NIH funding from non-Mayo entities. So that's the type of growth, that's the type of initial innovation that's really going to carry through. And then you also have the education space, right? Then you also have these colleges that are coming in. Winona State has expanded its operations downtown. UMR went from a class of 57 in 2009 to now having 26 different states having their students come. And the retention rate for UMR is about 30%, meaning that if you are attracting students, getting them interested in what is here, and then having them stay, compared to the University of Madison, which is about 27%, and University of Iowa, which is only 14%. So just some highlights. We can talk about the other bits later. And we can see that by the numbers, we have the Mayo investment in the light green bar and the total non-Mayo investment in the darker green bars. In 2018 and 2019, there was a lot of residential and hotel spent. So 10-year progress on private investment. Again, research and residential development is above target. The capital investment is on pace, maybe slightly lower than halfway. But the opportunities are really to reconsider office and retail in a post-COVID environment. And again, this is throughout the country. This one is not just Rochester specific, but also figure out ways to amplify the unique identity of Rochester as America's city for health.
Just to follow up on my question, I think it would be helpful for us, and maybe it doesn't come from DMC, but to also see where, in particular, research office, residential units, and maybe retail, how much of that space is occupied, so that we, to your point on the opportunities, reconsidering office and retail strategies, that maybe, if we have too much space, so that we can see how we're on target for meeting those needs.
So particularly for office, it is about 7% availability, which is a combination of vacant and to become vacant. Just for comparison, in Minneapolis, it's 14%, which is one of the lowest in the country. However, I will say that prior to the pandemic, Rochester only had an availability rate of about 1.2%. So while it's still low, for Rochester, it probably feels high. So that's the difference. It's about half of the largest cities, but it will probably feel higher from what you've seen pre-pandemic, just given those numbers.
Thank you.
I'm going to add to the opportunities. I think we've been having this discussion over the last 24 hours about what's happening around the country, and places that are destinations for vacations and that sort of thing are maybe seeing a little more vibrancy than some of us, where medical care is your vacation, just a little bit different. But that we need to provide opportunities, interactive opportunities in that retail space for folks. If you look in other countries and walk around, their retail space, as you walk in and there is stuff to do. It is interactive. I don't know how much money actually that space is making for people, but they have made it vibrant and interactive, and we have a lot of opportunity in Rochester for that if we get creative and don't just let buildings sit empty, that we activate them somehow to improve the feel of our first floor space. So I think let's work on that one.
I was talking with Doug Baker during the break. We were talking about North Loop in downtown Minneapolis, and that model of live and work seems to be a combination, and Tom, you might know more about this than I do. It seems to be working where it's the lines are blurred between retail, entertainment, food, living, office, and the model of a larger office building isn't coming back. And again, I don't know that we're even necessarily headed toward this, and the Mayo's uses and other spin-off is different. The shared lab, those are different kinds of facilities, but it just strikes me that that's going to look different, and Rochester actually may have some competitive advantages in terms of the ability to kind of create that.
I'm very interested in the residential unit number. What is the average price per those units? What is the average rental charged per unit, and how many of those are deemed affordable in the yeah.
We could definitely have that detail in the report. Are there any other comments on this section? Move into, I think we can pretty quickly go through public and
Yeah. You all know this better than I do. 277 million of the 585 million invested to date, which is about 47%. And some unique tools developed, the Main Street Grant Historic District, making sure that Rochester isn't just transformed into something that is unrecognizable, but making sure that the character stays and it is just amplified and built upon. One thing though is that 585 in public investment also catalyzed additional public investment. investment, right? There's additional grants, additional federal funding, over $100 million to date, that was not really even thought about in the original plan. So that is something that is above expected, leveraging additional non-DMC funds, public funds, and then also on target with 3 of the 6 public realm projects. The Link BRT is underway, multiple upgrades to things that we don't really see but are needed if there's going to be substantial growth in the future. So for opportunities, leveraging, how do you leverage the remaining funds to prioritize those impacts, and really what are the priorities to both near-term and generational infrastructure? So the things that you can see now, like Discovery Walk and Soldiers Field, and then the things that are needed for your children to see a difference. Both of those things are important, and it's a very tricky decision to decide how the funds are allocated to see both through.
Could I just comment on this? This notion of using our resources, using DMC resources for near-term progress as compared to generational infrastructure. Some of you have heard me say that how much of our resource goes to planting radishes versus apple trees, and radishes being something that you plant and in 21 days you can see and harvest it and taste it and enjoy it, versus apple trees, which take 7 years to mature, to start producing fruit, and then when it starts producing fruit, it keeps producing fruit. And I think that's part of the conversation in our community that we need to have, that an infrastructure organization, Link BRT is an apple tree, and our Main Street grant is probably a radishes. And we need to be doing both, and we need partners who can support us in doing both of those things. I have more metaphors if you'd like.
That's really good. From sports to farming. Yeah.
Patrick, maybe if I can chime in too. I really like this, especially as we look towards the next 5 years and beyond, the conversation about both what that conversation looks like in the community, specifically around ideas of America's City for Health too, which I think there's a lot to unpack in those statements, but like, how does that keep us focused on both the short-term and the long-term kind of generational discussions, and that really important, percentage wheel of where you invest some of that money, whether it be streets or sewers or public realm or things like that. And I think that this seems like the right time to continue that conversation and do that in a way that kind of brings community along and engages people directly in that conversation. So.
And if I just might add, thinking about the frame of City for Health or a healthy city, what I consistently see in the data from practitioners of urban design is that the most walkable cities tend to be the healthiest cities. And thinking about ahead to our experience, the anchor venues, how are we thinking about the connectivity that allows people for a farther distance to get on Link BRT, but for those closer destinations to just be able to conveniently, easily make the choice that's the healthier choice and the more socially connected choice to just walk. And that's how I think of Cities for Health, and I think is a huge generational opportunity to plant apple trees so that every member of this community has a healthy option.
And you have the benefit of here being a multi-layered city between skyways and subways and ground level, which many cities would really dream to have. So I think that's a really fascinating to think of then about how that interacts and how people can interact that at different levels as well.
Madam Chair, just a question. So it looks like the DMCC board has approved $270 million. I don't know if there's a forecaster within the board structure or not, but is there enough money left to complete the bold, forward, and unbound obligations that nearly $6 billion worth of new investment are going to bring to Rochester, of mail investment?
Yeah, I don't have the numbers in front of me. Maybe Patrick has them available, but.
Are we generally comfortable there's enough money left?
We're generally comfortable that there's enough money left to meet our obligations. I think the challenge for us is to think about where the most strategic investment opportunities are as we move that forward. So that's part of why we're doing the 5-year plan update later this year, and that's very much at the heart of our discussions right now, but we have confidence that we can meet our obligations.
Good, thank you.
Patrick, anything you want to add to that?
No, I mean, I think that's spot on.
Yeah.
Okay, the next part of the 2015 plan had a goal of now, instead of 20 years, 35 years. Taxes and new activity come a little bit after. So over 35 years, 7.5 to 8 billion in tax revenue. To date, we are at 1.6 billion in net new revenue generated. So this is maybe a little bit slower than if we were exactly on task for that 35 years. That number would be about 2 billion. But if we take a look at the different diversified revenue generating sources, the taxes are not coming from one place, right? And again, this is all net new. So for each of these different pieces, lodging these are the new hotel rooms. This is the average RevPAR, basically what you make per hotel room, given the occupancy rate, and the taxes that were generated off of those new hotel rooms. For the capital investment, this is that $1.8 billion in investment. Those generate income taxes, that generates additional business taxes, that is at 76 million. Personal income and business tax, these are off of those new jobs. So the value add on the business tax and the personal income tax is off of those net new jobs. Also included in the business tax is 73 million of Mayo's unrelated business income, so the money that they get from concessions and things like that, that is a publicly known number, was included in here. And then sales and use tax as well as property tax. This is the increment of the new properties that were built over time. What are those property taxes as a percentage of the entire city?
Unless I misinterpret terminology, on your previous slide it says 1.6 billion. Should that not be net new revenue generated as opposed to tax generated?
This is 1.6 billion in net new tax generated over the past 10 years.
10 years.
Yeah.
Can you just clarify what taxes are you talking about there?
This is any tax that would be generated. So this is
Sales
if it's
tax, income tax,
every
property
single tax, all the way up to state taxes. Yeah.
Did you say property tax?
Correct.
So,
Net
from a
new,
very
though,
simple
exclusively.
perspective, I mean, how much have we spent? We haven't quite hit, or are we at about 50% of DMC funding expended? From a number of different sources, but from the state's perspective, it's a pretty good deal, right? Return of close to $1 billion in personal income tax and business taxes going back to the state in exchange for the investment that they've made, right? And the sales taxes and property taxes are coming back to county, city, school district, which is not insignificant either, close to 500 million.
So I think you're making the point exactly, and that's the expectation the state had when making this promise, or the promise that was made to the state, is it would generate, and if you go back a slide, and I think because it's really important too, this is not about taxes being raised,
Right.
not about any government agency raising taxes, although that may or may not have happened. It's about, if you look at personal income, when there are 17,000 new people, they're all paying income tax that were not paying income tax because they didn't exist, reflecting 756 million. That is a very good deal for the state of Minnesota, as that is income tax going to the state of Minnesota through the growth of employment in Rochester. And so I mean, you're making the point exactly that that was the promise. One of the reasons to invest state infrastructure, state funds, cities funds, in this very intentional strategy, it was grow the economy. And by growing the economy, it would spin off new taxes.
I agree that that's a big number, but it's not where we expect it to be though, right? I mean, we expect in the next 25 years to have $6 billion more in taxes. Are we going to be able to reach that is the question.
That's definitely the question, but it is really the early stages of all of the infrastructure. So a lot of the taxes are really on the capital side, and it's the ongoing operations is where you're really going to see the fiscal bang for your buck. A lot of economic activity generated from the initial investment, but if hopefully these jobs stay and there's an increase in jobs, those jobs create more jobs. You have indirect and induced effects of the spending of that. So we would not actually, it is lower. It would be about 2.1 billion if it was 10 years out of the 35, but that's typically not what we see. We see more of an exponential relationship between investment. It does take a little while to catch up, but it is definitely not a number that I would think is not meeting the mark.
Thank you.
Did you include the healthcare provider tax in that?
We did not.
Okay.
That was
that's a lot of money coming out of there.
It is a lot of money, and it was not a number that was publicly available. So we do estimate when things are not publicly available, but was not one that we were comfortable with the amount of data that was put out there to do. So that is a big chunk that is not included. That would make this probably closer to the 2.1, but that's not something that we're going to estimate on Mayo's behalf if it's not.
I think that is an important thing to be clear about, though, that this number does not include that, because the commissioner is right that that would be significant, and we just need to be transparent that that's not included in these numbers. Let's keep moving.
Okay. So our fourth core goal from the original 2015 plan was very intentional, that there would be this built environment investment, but really the chief goal of these 6 different areas and these 5 different plans is to change the experience, the lived experience of 5 core user groups. Now, unfortunately, from somebody who is pretty quantitative, this is a very qualitative, it's a hard to measure feature, right? It's hard to measure the experience, but it's the experience between employees and residents, so people that are here on a day-to-day basis, patients and companions, as well as visitors. In part of the number of hotel keys, we had the 693 hotel keys, and we can see here that the major developments of those 6 newer hotels since 2018, we can see that from 2000 to 2015, there were about 500 keys increased. But if those 6 new hotels in the DMC were not created, that alternative baseline that we see, that 2,600, that was from hotels and motels that came off the market. So without the investment into those hotels, we would be at a place that was basically where the hotel market was back in 2000. In terms of places to live, again, the goal was 2,850 units. Approximately 1,580 have been onto market to date. I do want to say that this does include 229 student housing units from UMR. So it's about 1,300 new residential units. This is from 11 buildings downtown that this is net new residential units. And again, we did have a question about affordability. This is not specifically for just the new units, but the costs have risen on average in the city from about $1,100 to $1,300 over the 10-year time period. And housing affordability, again, it's on everybody's mind, no matter where you are in this country. So it is something that going forward, I think, is an opportunity to really hone in on. We have the units, but are they affordable? Things to do. I found out yesterday that there are over 250 live music events every year. The Chateau Theater also has 242 days of entertainment. There's been ample programming, 70 pieces of public art, as well as the beautiful Mayo Civic Center, the Rochester Civic Theater. And this type of momentum and this type of connecting individuals, whether they be visitors or residents, are really the things that are going to improve the user experience as envisioned by the original 2015 plan. Places to eat. There have been 49 restaurants open since 2015. This was data that was collected both by Lightcast and from the DMC EDA. Unfortunately, 25 of those 49, not exactly, but 25 restaurants have closed in that time period. That is something that happens. We know that it is a very volatile market, especially given a pandemic. But what we also found was looking back to 2012, we were able to scrape some data from OpenTable, and there was only 2 restaurants on OpenTable, a couple reviews. Now there's over 15 restaurants on OpenTable, and again, that is a more high-end class of restaurant because you have to pay for the software. So it is definitely a smaller sample, but there's over 10,000 reviews now. So just the change in the restaurant landscape over that time period has been substantial. Getting around, we can see that throughout the different corridors and the different sub-districts within the district, the walk score and bike scores are all around 80. Typically, if you ask a realtor what would be a good walk or bike score if you want to get around without a car transportation, it's 70 or above. We can also see here that there was an additional 72,000 car trips have been anticipated to have been foregone because of the city e-bike from the Lime scooters and the e-bike trips. So again, having additional, we call this last mile mobility available within the city is going to have people will be able to walk and then take a scooter. That enables a healthier city, a more connected city. And then livability. AARP puts out a livability index every year for every single city within the United States. They do a top 100 and they piece those out into 4 categories based on size. The categories that we see of the top 10 here are between 100,000 and 499,000 people. And we can see that Rochester is really a little bit ahead of St. Paul and Minnesota, but really tied for the number 4 within that category of all of the cities that are between 100,000 and 500,000, the top livability. So that is something that is very important, and this is from a third-party provider that does this review consistently over the year.
And before you go on, can I just highlight, in the public safety category, Rochester had the 3rd lowest crime rates among other livable cities. I think sometimes we get caught up in seeing headlines and we don't keep it in perspective. We have a very safe city and we should be proud of that. So just wanted to highlight that one.
And lastly, these very, very important public space investments that really make a better user experience to feel like you are connected and you are in a cohesive space. Peace Plaza, Discovery Walk, and Soldiers Field, we have seen the increased use of these public spaces and the ability for families to connect the different pieces and the different factors of the city throughout downtown. So above expected, walkability and mobility enhancements. On target are the public realm improvements, 3 out of 6 planned, right at the halfway mark. And again, the opportunity is to bring more visibility to connected retail, dining, and entertainment, right? Really feeling like there's a connectedness between all of these different pieces that the plan laid out. It's now time to connect those into one singular vision, which was really laid out in the original plan, but there's a forward-looking plan for the next 5 years to figure out what that will look like.
Quick point on the housing piece. I think this is good news. Obviously, we got a lot of work to continue doing, particularly on affordable housing, but to see cost burden decrease from 16.4 to 12.8 is significant over that decade. There's not a lot of communities that are seeing that trend, I'm betting.
And that is actually one of the data points that was from, that data point is the city of Rochester, to be clear, not DMC in particular. That is actually from the AARP Livability Index, so they're using the same metrics over time and comparing the same metrics to other cities. So in that way, it is a very nice stat to be able to compare apples to apples, both previous and comparatively, geographically.
I think that's great.
But I do think that it is really stark to see the new residential units in the district from 2000 to 2015. There's really no growth. So So we would say that that might be an actual causal event, not a correlation.
I wanted to talk a little bit about, I totally understand the data here is quantitative, and but with these groups, employees, residents, patients, companions, visitors, that qualitative data I think is really important. And speaking from my position with the city, especially during the next 5 to 7 years, we're going to really want to know what that qualitative data is, as a lot of dust is going to be coming up with construction. So I'm wondering if there is a way to kind of, I don't know that now is the time to benchmark that, but to kind of keep us having a pulse on what the feel is for all of those important stakeholder groups.
Yeah, I think you're absolutely right. The best time to collect data and establish data is 20 years ago. The next best time is today. And I think that you're absolutely right. We should find a grounding today that is more measurable for the years to come. Pam, I just want to do a time check, and we're getting on to 3 o'clock, and what, some guidance.
I think I'm going to suggest that we quickly move to more open observations, comments, ongoing questions that maybe groups will want to come back to in the future. And unless there's something really notable in the plan review or the unique tools, I would say let's just open it up for discussion.
I think that makes sense, yes. Planning is really something we've been doing all along, and we'll continue to build those partnerships and relationships and launch the next 5-year vision. So I think we can open it up.
So we started a little bit late, and now we're running right down to the appointed time, and I'm sure people have commitments after this, but are there any general observations or anything anyone wants to share, something they learned today that surprised them, something they're curious to learn more about?
It may be private or private information, but I would, as Dr. Noseworthy talked today about growing the Mayo practice because of medical economics, has the Mayo practice grown? I mean, in terms of numbers of patients seen over the course of time. Just a curiosity. You don't have to answer. You probably don't know the answer.
Nick, you look like you have a question or comment.
Thank you. I do. And I've been thinking about the comment of radishes versus apple trees. And one of the radishes I would love to see and just think about more broadly is the commuting experience in an integrated MPO, DMC, RDA, Mayo Clinic, City of Rochester. How are we, because downtown, particularly the DMC district, is such a trip generator for people, how are we planning that integrated transportation experience, and how are we shifting or providing incentives? I think about cities like Boston and their medical district that have shared parking models, transit management organizations, and we had Arrive Rochester as an app and an experience. It's largely no longer in existence, and I think it's that soft programming that makes the infrastructure work ultimately.
Thank you. So I won't respond to any of these. These are all really great questions, and I think it's important just to get them on the table.
Absolutely, yep.
I was just going to say to the radishes and apple trees, I think the chair and I kind of agree that maybe a better metaphor than radishes, to many of us, they are not that appetizing. So.
Really? You learned something?
They're healthy.
There you go.
Carrots, maybe.
Yeah.
Other comments, questions? Observations? Tom?
Well, another thing about going forward, in addition to disruptors like AI, is just the changing context from Washington, D.C. that we're in. I was in a Department of Homeland Security meeting last week, and they basically said, we're not here for you anymore. So FEMA won't be here. So how do we build resilience into our planning going forward? Because the federal government isn't going to be here. So that's another disruptor we have to think about.
I raised a similar question in this morning's meeting around cuts to NIH, health research cuts, and the impact potentially on Mayo and the sector as a whole. Again, just something to keep our eye on, obviously.
Could I suggest one last exercise?
Yes.
Because there are some people who have been more quiet today, and
around the
perhaps,
room.
yeah. if people would just take a moment to write down the one thing that they hope comes out of this, or one thing that we consider is in this next update, just to write that down. Take 1 minute to do that, and we'll go around the room and just ask people to say what that is.
Okay.
We find that quite valuable.
And if you can remember it without writing it down, that's fine too.
Well, yeah, you gotta write it down, otherwise you change your mind.
Just a heads up, I'm gonna start with Mayor Norton and go to my right around the room. Okay. Yep. Go ahead.
I would say the idea of walkable, livable communities and how can we assure that the apples include everyone?
We're gonna skip staff, yep.
Well, thank you very much. You know, again, as commissioner in the county, who we deal with the people that are just starting out, the low-income people, housing is something extraordinarily important. Yes, Rochester, because of the economic engine that it is going to attract the PhDs, the MDs, the entrepreneurs, but they're also going to attract the people that are going to be here for a step up, because they're going to see an opportunity. And we must also remember that opportunity means jobs for those people that don't have a PhD, that are not an MD yet. And to go, I don't like the metaphors, but I mean, it's a good one. If you're looking for the apples, they're in the county right now. Those are the families and the people that we're dealing with. And if you want a golden delicious in a few years, then we need to do something about that. The affordable housing is not found downtown, and it's not in the DMC, but yet we know that housing creates stable families that you're going to need to create those apples in the future.
Now, I know you didn't write all that down. I know you didn't write all that down.
I did write all that down.
So only what you wrote down, you can only say what you wrote down going forward.
All right,
Thank
Doug,
you
hang
very
on just a
much.
second. I'm gonna let Randy go next because he and the mayor have to leave, so hang on.
I was just going to say, and kind of picking up on the generational or apples metaphor, I really was struck by Councilmember Miller's comments about really looking at the city of health through what we can do to enhance pedestrian and walkability, to really marry what we know of as being the city of health because of Mayo Clinic, but then also really living and breathing that in as residents and visitors and others to the city.
All right, thank you. Doug, back to you.
Can I have two?
Sure.
So first is business starts and making sure that we are tracking our productivity in terms of generating investment into hopefully return. Second would be the other big engine here is people coming in to be treated at Mayo and understanding their experience through this whole thing too. So, and I completely agree on livability and we've got to understand impact on residents of this area, but also on those who are coming in to be treated. And they're going to have somewhat divergent needs as you go through here, which may actually make it a little easier to meet both. But
I would hope that the information shared here, as well as earlier today, could be shared, clearly communicated to a public who sometimes finds themselves disenfranchised or inconvenienced and recoil at the sight of cranes and lane closures.
I would say, can we, in some fashion, say at the end of this journey that we've reduced greenhouse gas emissions in our footprint in downtown Rochester? I think that would be a nice thing to put in the appendix of this report when it's over with.
Thank you.
Very cool.
Well, the world we live in is changing very dramatically. And in the first 10 years, we have been resilient to get through some things we didn't expect, like COVID. And I think what Tom Fisher and Paul Williams mentioned a few minutes ago, I think is absolutely critical, that what we've relied on in the past may not be there in the future for the next 10 years of this experience.
Thank you.
I'm looking for the assurance that we are not leaving any sector of Rochester residents behind.
Thank you.
Well, from what I've seen, patients generally from out of town that do come to Mayo, how do they get around downtown with minimal confusion? Not including construction, just that in general.
So to the comment earlier about skyways, subways, and the street level, I think of Mr. Ryback and his comments from past meetings, is that when we think about the investments that we can make that are most transformative, it is at the street level for walkability, accessibility, universal design, and connectivity for all people, residents, patients, visitors, because that improves the experience, and economic vitality of everything. And so I think of the barriers. Broadway is one, and I'll leave it there.
Thank you.
Clearly, the laser focus is Rochester and the DMC area, but as we go through this process and into the next 10 years, if we don't look at the impact on our outlying communities and residents, and I've talked to a lot of Mayo patients who can't wait to get out of Rochester. If they're here for many weeks, they want to get outside the confines of the city. So what are we doing to support those outlying areas, communities, residents, and businesses along this journey?
Yep, thank you.
My takeaway from today is that it's imperative that we stay closely and actively connected with the community members, the people directly affected by growth and change, and who experience this kind of growth on a daily basis as a direct lived experience.
Thank you.
My takeaway is just to think about the next 10 years as an opportunity to use health as a lens through which we make every decision, in not just human health, environmental health, economic health, social health. The real opportunity here is us to create a different kind of a way to think about development that isn't quantifiable in terms of square footage of retail and numbers of keys in hotel rooms, but how is health the measure of our success?
My two words, community engagement, the importance of engaging community, community voice, especially as we are looking forward at the next 5 years, folks who are on the ground, moving past master plans and those kinds of professional documents and having more kind of real-time dialogue.
My hope is that for a true 10-year vision, that DMC look at expanding what it considers to be part of the downtown. Over a 10-year period, what is currently considered DMC boundaries must be expanded.
Thank you. I want to express my sincere appreciation for the collaborative spirit that is in this room and in the previous rooms and in our community, and I want to amend my previous comments. I think we're the best city in America. And I'm looking very much forward to more cures for our patients. We are those patients in the future.
I'll just say that the only thing worse than growing pains is not having growing pains, and we are very fortunate.
I think on that theme, I hope that there's been enough trust and collaboration and communication that has grown and developed between the various parties to get us through this next disruptive construction period and to work together intentionally and productively to mitigate the negativity that any business owner, resident, or patient or employee might experience. And through this process, I hope we have the ability to step back and think clearly and creatively about the best use of DMC resources in the next 10 years to maximize the benefit that will exist long-term for this community. That's great. I want to thank everybody here. Patrick, do you want to make any closing comments?
Just to wrap it up, I do want to just thank Beckie and Michael, our support consultants on this, Catherine's leadership for this session, looking around the room, Chris, Jamie, Allison, Mike, Brooke, Kyle, Anna, I can't turn around all the way. All of the staff that have helped orchestrate today, and so that you all could contribute to this conversation and discussion today, so thank you.
And our thanks to the Hilton as well, for hosting us. Well, thank you. It felt too short and too fast, but I'm sure we will talk again about the results of the first 10 years, and I'm sure there'll be a way to share this in your own jurisdictions and environments if you have an interest in doing that. All right. Thanks, everybody.
Thank you.